For men seeking to improve their sexual experience, Viagra is often seen as a miracle drug. Taking the blue pill, however, is not without consequences. From skin cancer to penile amputations, here are 9 horrible facts about Viagra you definitely should know about. Number 9. Penile amputation. A more severe and extremely painful form of priapism is the ischemic type. In ischemic priapism, the blood remains in the penis for unusually long periods, causing the blood to be deprived of oxygen. When this happens, the penile tissue becomes damaged, and in extreme cases, it develops severe vascular disease, resulting in gangrene. In 2013, a 66-year-old Colombian farmer named Gentil Ramirez Polania from the fatefully named town of Gigante suffered an excruciatingly painful erection that lasted for days. He had reportedly been taking too much Viagra that he bought at a local chemist in an attempt to impress his new girlfriend with his sexual prowess. When the pain became unbearable, he sought medical attention at his local doctor. By then, his manhood was found to be badly swollen, inflamed, fractured, and showed signs of gangrene. He was quickly referred to a nearby specialist center, where the doctors were forced to take extreme measures to save the man's life. In order to prevent the gangrenous tissue from spreading to the rest of his body, there was no choice but to amputate most of his penis. The old man luckily survived his ordeal, despite leaving the hospital with a short penile stump. Number 8. Long-lasting erections. Insecure men often take Viagra pills, thinking that a harder and longer erection would boost their performance and provide better satisfaction. That is, until the erection refuses to go away and becomes severely painful. There have been countless reports of Viagra-related priapism, which is a penile erection that lasts for hours, long after stimulation has ended. It is a rather painful condition that could sometimes last for days. In 2015, British construction worker Daniel Medforth took 35 Viagra pills within an hour as a joke. According to the 36-year-old, he swallowed the sex pills for laughs during a drunken bender. He ended up with a large erection that refused to go away for 5 days. He felt sick, dizzy, and experienced hallucinations. Daniel confessed his actions to his wife, who then called an ambulance, and he wound up in the hospital for nearly 2 days. He said that whenever his penis brushed against something, it sprang into life, and the doctors and nurses tried their best not to laugh throughout his treatment. Number 7. False beliefs and drug abuse. Sildenafil, better known by its trade name Viagra, is part of a drug family called phosphodiesterase 5 inhibitors that are meant to help people with erectile dysfunction. Through a series of chemical reactions, it regulates blood flow in the body and increases its flow in the penis. Although it is meant for those with incompetence, many healthy men not suffering from the medical condition often use it recreationally. People are tempted to increase their sexual performance with Viagra, even when they do not really need it. They believe that the drug would help improve their sexual performance or could permanently increase their penis size. Studies, however, have shown that it has little effect for those not suffering erectile dysfunction. Adversely, it could lead to serious consequences. Another common misconception about Viagra is that it could boost a man's sex drive. That idea, however, is false. What the little blue pill actually does is increase blood flow to the penis, resulting in longer erections, sometimes much longer than necessary, without any increase in libido. This would result in an uncomfortable and often painful situation. Number 6. Skin cancer. In April 2012, John Wood from Minnesota passed away from metastatic melanoma after 11 years of using Viagra. He started taking the drug in 1998 to treat his erectile dysfunction shortly after it was made available in the United States. Following his death, his wife sued the drug's producer, Pfizer Inc., for allegedly holding back information about its potential to cause melanoma. For years, there has been a long-held belief believe that Viagra raises the risk of developing skin cancer. Scientists have been researching this topic for years, and recent studies have shown that there is indeed a correlation between the drug and melanoma, the deadliest form of skin cancer. In 2014, a long-term study of nearly 15,000 men in the US was published, suggesting a link between Viagra and malignant melanoma. This correlation was confirmed further in 2015 by a study of 24,000 men in Sweden and another study at Germany's University of Tübingen that was published in 2016. The conclusion was reached through experiments with human cell cultures and live animals. Normal human cells contain a phosphodiesterase enzyme that breaks down cGMP, a messenger molecule responsible for the growth of malignant melanoma. However, Viagra inhibits that protective enzyme, thus causing the skin cancer to grow vigorously and unopposed. Number 5. Deafness. Doctors have warned that Viagra, along with other similar impotence drugs, may cause deafness. There have been many cases around the world where people taking the little blue pills experience sudden loss of hearing in one or both ears. Other symptoms include tinnitus or ringing in the ear. A study was carried out by researchers in Charing Cross Hospital, London, and several other hospitals in UK. The report, published in 2011, showed 47 suspected cases of sensory neural hearing loss related to the use of Viagra and other PDE5 inhibitor drugs worldwide. In addition to that, a further 200 plus of similar reports were submitted by the FDA from the United States. Experts are still not quite sure how exactly Viagra affects hearing, but a theory is that increased blood flow to the delicate auditory systems inside the ear may cause some parts to be damaged. Number 4. Blindness. From clinical trials, Viagra is known to cause several side effects relating to eyesight, such as photophobia and blurred vision. Some users have even complained of cyanopsia, where everything is seen tinted with blue. Doctors have recognized that Viagra causes temporary vision problems in healthy men by obstructing the enzyme that sends signals from the retina to the brain. Some view these as nothing but common and reversible adverse effects, with no serious consequences. After years of the drug being made public, more and more serious side effects have been popping up. In 2001, an eye specialist from the University of Maryland Medical Center reported 5 cases of males across the US who have lost their vision after taking Viagra. The blood vessels and nerves behind their eyeballs were found to be tightly constricted and bundled together. They were diagnosed with ischemic optic neuropathy, a condition where blood flow to the eyeball's optic nerve gets cut off. It is rather common in people with vascular disorders like diabetes mellitus and hypertension. In 2014, Australian researchers discovered that people with retinitis pigmentosa are more susceptible to becoming blind after using Viagra. Retinitis pigmentosa is a rare inherited eye condition where certain photoreceptor cells in the retina would progressively degenerate over time. It is now believed that Viagra worsens the conditions even more, causing permanent damage and blindness. Experts warned that people with normal eyesight should also worry about taking the drug, as they might be secret carriers of recessive genes for retinitis pigmentosa. It is estimated that 1 in 50 people unknowingly carry those genes. Number 3. Brain hemorrhages. In 2014, a 27-year-old man from Tumkur, India, collapsed and died suddenly while having sexual intercourse with his teenage girlfriend. Shocked, the girl informed the police, and a post-mortem examination found that there were no external injuries on the body. The cause of death was brain hemorrhage, as the sexual stimulant caused the blood vessels in his brain to dilate too much and rupture. There have been several other reports of people people dying from brain hemorrhages after taking Viagra to increase their sexual performance. In 2016, doctors from Baylor University Medical Center in Dallas, Texas, reported that they have found 5 cases of intracerebral bleeding and 2 cases of subarachnoid hemorrhages relating to Viagra intake. Their most recent case was a 49-year-old man who had a pre-existing aneurysm in his brain, but was unaware of his condition and had no family history of it. He took Viagra prior to sexual intercourse and fainted suddenly during the activity. He was rushed to the hospital, and a CT scan revealed a massive subarachnoid hemorrhage in his brain. Because of the effects of Viagra, his unknown brain aneurysm had widened and ruptured. Luckily, doctors managed to save him. Number 2. Counterfeit sex pills. Although Viagra is widely available, it can only be obtained legally with a medical prescription. Since many people want to use it recreationally, this has created a high demand for the drug in the black market. At the moment, Viagra is one of the most counterfeited drugs in the world. This has created a huge problem, as the illegal production of these blue pills do not conform to safety regulations. Counterfeit Viagra may look exactly the same as legit ones, but can be extremely dangerous. Still, people are willing to take the risk and use their bodies as test subjects. A report by Forbes in 2012 stated that about 77% of Viagra sold online may be fake. Many men prefer to buy the pills online for privacy, without realizing that online pharmacies regularly sell fake, ineffective, contaminated, and expired drugs that are unsafe for use. If the Viagra pill you find online is prescription-free and cheap, chances are it is fake. Fake Viagra pills tend to be full of horrifying toxic ingredients. Lab tests have shown that they contain things like detergents, road paint, and talcum powder. Furthermore, there is no way of knowing for sure the real dosage of the active ingredient in any given fake pill. This could potentially lead to serious side effects like loss of consciousness, dangerously low blood pressure, and even heart problems. Number 1. Deadly combinations. Viagra should never be taken by those taking hypotensive medications like nitroglycerin and alpha-1 blockers. This could result in a severely dangerous drop in blood pressure and even death. Viagra in combination with antiviral drugs like protease inhibitors could also be deadly. Protease inhibitors are usually taken in the treatment of HIV and hepatitis C. It has a synergistic effect on Viagra, increasing its plasma level multifold, leading to severe side effects. Viagra is sometimes used by drug abusers to counteract the effects of illegal substances like MDMA or ecstasy that tend to cause erectile dysfunction. This combination, known as sextasy, is dangerous and known to have caused deaths as a result of fatal drug synergy and increased side effects, especially when alcohol and other drugs also come into play.
He is one of the few remaining members of the Medellin cartel, surrendered himself to the justice system, and he was released in August of 2014. We're gonna have him take us around to the different spots around Medellin